The initial classification was asphyxia due to positional asphyxiation. A second examination produced a different conclusion. The cause of death was listed as strangulation, confirmed by distinctive ligature marks on the neck. Upon further dissection and microscopic analysis, the medical examiner observed petechiae distributed across the eyelids and conjunctiva, indicative of severe occlusive vascular pressure. Additionally, hemorrhages within the soft tissues of the neck corroborated mechanical force application. The deceased exhibited bilateral hyoid bone fractures consistent with manual strangulation or use of a ligature. These findings were substantiated by microscopic evidence of subhyaline membrane rupture and alveolar wall disruption in the lungs, indicative of sudden respiratory compromise leading to cardiac arrest. Given these anatomical observations, the medical examiner concluded that mechanical asphyxia was the definitive cause of death. Chapter: Case Background. The incident under investigation occurred on March 15th at a residential apartment complex in downtown Springfield. At approximately 9:30 p.m., a neighbor reported noticing unusual activity outside the deceased's residence. Initial observations included signs of forced entry and items scattered throughout the hallway near the deceased's door. The neighbor entered to check for any immediate assistance needed, but upon discovering no one inside, contacted local emergency services. Emergency responders arrived at 9:45 p.m. Upon entering the apartment, they found the deceased in a prone position on the floor with visible neck ligature marks and signs of struggle around the living area. Initial assumptions were based on evidence suggesting a break-in had occurred, leading to an altercation. However, no suspects were identified during this initial assessment. The case was subsequently referred to the medical examiner's office for further evaluation due to the nature of injuries observed at the scene. Chapter: Initial findings upon arrival at the residence. First responders noted a seated position of the deceased on a living room couch, head tilted backward against the armrest. No immediate signs of trauma were visible to the naked eye. However, paramedics observed slight cyanosis around the lips and an unusual glistening quality to the skin overlying the neck consistent with postmortem changes. The scene was cordoned off as per protocol, and initial observations indicated no environmental hazards or substances that might have contributed to a non-natural death. A preliminary medical assessment by emergency services revealed normal body temperature, but noted irregular breathing patterns before cardiac arrest, suggesting respiratory compromise prior to death. Given the absence of visible external injuries and the nature of the victim's posture, coupled with the reported lack of recent illness or injury, strangulation was considered as a potential cause of death. This hypothesis necessitated further forensic examination by medical legal authorities, leading to an autopsy to confirm the presence of ligature marks on the neck consistent with mechanical asphyxia, thus triggering a comprehensive investigation into the circumstances surrounding the deceased's demise. Given the absence of visible external injuries and the nature of the victim's posture, coupled with the reported lack of recent illness or injury, strangulation was considered as a potential cause of death. Chapter: Forensic investigation. Upon arrival at the residence, the initial survey revealed a single ligature mark encircling the neck of the deceased. A length of nylon cord was found partially buried beneath carpet fibers in close proximity to the body, suggestive of its use as a ligature instrument. Swabs collected from both sides of the cord for DNA and trace evidence were placed into individual envelopes labeled with corresponding case numbers and collection timestamps. The neck region of the deceased exhibited pronounced petechiae and hemorrhagic streaks consistent with strangulation trauma. Notably absent was any sign of defensive wounds, indicating a rapid onset of unconsciousness prior to death. All collected items were meticulously documented and sealed in tamper-evident bags, adhering strictly to chain-of-custody protocols before transportation to the forensic laboratory for further analysis. Upon examination of the deceased, specific tests, including, but not limited to toxicology screens and serological analyses, were conducted to rule out alternative causative factors for death. Histopathological analysis was performed on tissue samples taken from ligature marks present around the neck. Microscopic evaluation revealed petechiae formation within the conjunctival vessels, indicative of hypoxic stress consistent with asphyxia. Hemorrhagic areas and subepidermal blood blisters were noted, confirming mechanical pressure application to the cervical region. Additionally, histology confirmed the presence of a noose ligature material adhering to skin samples. Detection thresholds for toxins were set at clinically relevant concentrations. All results fell below these levels, supporting strangulation as the definitive cause of death. The examination of neck ligature marks revealed a definitive pattern consistent with manual strangulation. The presence of petechiae and hemorrhages in the conjunctiva further corroborated this finding, indicating an obstruction of blood flow to vital brain structures. Microscopic analysis confirmed the absence of defensive wounds, suggesting the deceased was likely incapacitated during the act. Based on the decomposition stage and insect activity observed at the scene, the postmortem interval was estimated between 24 to 36 hours prior to discovery, with a confidence level of 90%. This timeline corroborated witness accounts placing the deceased in the vicinity shortly before their reported last communication. It also contradicted claims that the deceased had been seen alive several hours after the initial timeframe proposed by forensic evidence. The examination of neck ligature marks revealed significant external bruising and petechial hemorrhages consistent with manual strangulation. Ligature material embedded within the skin provided clear evidence of mechanical force application, corroborating the presence of defensive wounds indicative of a struggle. Histopathological analysis confirmed subcutaneous hemorrhaging and hyoid bone fractures, supporting the conclusion of asphyxiation due to neck compression. The expert would testify that while ligature marks provide compelling physical evidence, their interpretation requires consideration of additional forensic data, such as toxicology results and wound pattern distribution. In this case, the expert opinion is conclusive regarding strangulation, but interpretive in assessing the dynamics of the fatal struggle based on available physical evidence. Chapter Resolution: The final determination of death by strangulation is unequivocal following a comprehensive review of all forensic evidence. The neck ligature marks, initially observed as potential trauma, were confirmed through microscopic analysis to be consistent with pressure applied from a constricting device, indicative of manual or ligature-induced mechanical asphyxia. Initial assessment suggested the possibility of a struggle, but subsequent examination revealed no defensive wounds on the deceased's hands or arms. This finding aligns more closely with an act of restraint rather than self-defense. Additionally, the absence of petechiae beyond the cervical region supports the conclusion that death was instantaneous due to rapid loss of consciousness. CT and MRI scans provided further confirmation through visualization of hemorrhagic pooling in the hypopharynx and laryngotracheal mucosa, consistent with occlusion of airway flow by external force. These findings were corroborated by toxicology results, indicating no presence of drugs or alcohol that could have impaired judgment or motor function. The central finding was established by integrating anatomical evidence with forensic pathology techniques, thereby resolving initial uncertainties regarding the cause and manner of death as strangulation, ruling out alternative scenarios such as suicide or accident. These findings were corroborated by toxicology results, indicating no presence of drugs or alcohol that could have impaired judgment or motor function. This case underscores the critical importance of meticulous examination and documentation of neck ligature marks in cases of suspected strangulation. Detailed forensic photography, precise measurement of injuries, and comprehensive histopathological analysis are essential for definitive conclusions. The file remains open,